Excellent. Why don't we get started? Thank you to everybody for joining us. My name is David Jordan, the President and CEO of United Methodist Health Ministry Fund, a statewide health foundation located in Hutchinson, Kansas. We are really excited for today's webinar. Today's webinar is 5 years in the making, and we've been able to partner with a great group of foundations from the Hutchinson Community Foundation, the Kansas Health Foundation, the Reach Healthcare Foundation, and the Wyandotte Health Foundation. All of the foundations really have taken an important view in investing in this project of trying to think through how we can make an impact through investing early. Understanding that investing early childhood initiatives can create not only the best health outcomes, but a great return on our investment. At the Health Fund, investing in early childhood development is one of our three strategic focus areas. And we see investing in evidence-based early childhood development as a way to ensure that our youngest Kansans can enjoy nurturing family environments so that they're primed for a healthy life and prepared for school success. When we started this project, we looked at a number of factors impacting early childhood health. And we recognize that compared to the national average, Kansas kids are more likely to endure adverse childhood experiences than their peers in other states. ACEs are chronic persistent stresses such as abuse, neglect, parental abuse, or prolonged absence, maternal depression, economic instability, and family relational problems. Research shows that when children experience multiple chronic stressors or multiple ACEs, the support of caring and nurturing caregivers is essential to help buffer that toxic stress that results from ACEs. We know that toxic stress has a major impact in the overall development of children and also in their physical health and their ability to exercise self-control, which is critical to learning. So in partnership with our funding colleagues, we were really looking at evidence-based interventions that can help support the development of caring and responsive relationships between adults and children early in life so that we could avoid some of these developmental delays and chronic health concerns caused by ACEs and continuously elevated levels of cortisol. And in partnership with the Hutchinson Community Foundation, the Kansas Health Foundation, the Reach Healthcare Foundation, the Wyandotte Health Foundation, the United Methodist Health Ministry Fund invested in a statewide demonstration project that utilized an evidence-based intervention known as the Attachment Biobehavioral Catch-up program, or ABC. And ABC was developed and evidence has shown that the intervention can regulate elevated infant toddler cortisol levels. So really get at some of this important issues early in life to help normalize cortisol levels and really strengthen the relationship between kids. ABC has been given the highest available rating from really critical research clearinghouses at SAMHSA, the Department of Health and Human Services, and the California Evidence-Based Clearinghouse for Child Welfare. We know that ABC can also aid in school readiness, student success, and prevent interaction with the child welfare system. And as foundations, we wanted to know how this intervention could impact Kansas kids, especially in the areas of social emotional development, school readiness, and long-term health. We also know that evidence-based home visiting models like ABC that focus on building attachment and secure relationships are a proven two-generation approach to addressing racial and health equity. So again, I'd like to thank our funding partners that embarked on this multi-year, multi-site project with us, as well as to thank the project sites, Horizons Mental Health, Live Well Northwest Kansas, Project Eagle, Rainbows United, Russell Child Development, the research team at the University of Kansas, and the team at the University of Delaware that's been providing support to this work. The results today you'll hear will outline the impact of this intervention on Kansas families, as well as understand how the program is better implemented. Following the presentation from Amy Mendenhall, who's the lead researcher at the KU School of Social Welfare, you'll hear from Katie Schoenhoff, the Health Funds Program Director, and two home visitors who have done amazing work working with caregivers to implement the ABC program, Dana Schatz of Russell Child Development and Blanca Ainsborough of Project Eagle. And then we're fortunate to be able to be joined by State Senator Pat Petty, who is an early childhood policy leader and really a leader in supporting Kansas families and children, and Rachel Marsh, the CEO of the Children's Alliance. Both Senator Petty and Rachel will be able to speak to how this intervention has potential to impact health, child welfare, and economic opportunity in the state of Kansas for families. So we're excited about today's presentation. Thank you for joining us. Just a couple of quick housekeeping notes. The presentations will be done in the order you see on the screen. Dr. Amy Mendenhall talk about the ABC experience, and then the reaction panel. We'll have a brief ability to ask questions and answers following Dr. Mendenhall's presentation. Please put questions and answers in the chat, and then we'll have time for discussion at the end of the webinar. Any question or issue that we don't have a chance to tackle during the webinar for whatever reason, we will be able to provide a summary in terms of an FAQ that we could send out afterwards. Today's presentation is being recorded, and we will send a link out following the presentation. So if you have any questions on logistics or for any of the presenters, please put them in the chat, or any other observations. Also, please feel free to introduce yourself in the chat by putting your name and organization. Again, many thanks for you joining us, and many thanks to all of the partners, funding partners, the members of the team at the 5 sites, team from KU and University of Delaware, and policymakers for joining us, and for all the work that you've done to help ensure ABC is a success. So with that, I'll turn things over to Dr. Amy Mendenhall. Thank you all so much.
Thank you so much, David. All right, let me get my screen there. All right. Can you all, everybody see that? All right. Okay, well, I am very excited to be here today to share the results from the evaluation. As David said, I am Dr. Amy Mendenhall from University of Kansas KU School of Social Welfare, and the lead for our evaluation. And I'm going to quickly go over the results from the evaluation from phase 1 of the Kansas ABC Early Childhood Initiative. So as David mentioned, the goal of the Kansas ABC Early Childhood Initiative was to expand early childhood capacity in Kansas and to evaluate the replicability and efficacy at scale of integrating an evidence-based intervention into an array of early childhood home visiting programs through the 5 sites that were mentioned. There was an early pilot of ABC in Kansas, and it had positive results. And so there was really a desire to expand to other sites and other settings, other geographic locations across the state to see if those early pilot results held up as it expanded into different settings. Again, ABC is a brief evidence-based parenting intervention for caregivers of infants and toddlers who have experienced that early adversity. It was developed at University of Delaware by Dr. Mary Dozier. It consists of 10 sessions that are supposed to occur in the home, working with the family in the home setting. And it focuses on the development of secure attachment, nurturance, and positive regard. Research has shown measurable long-term positive impacts. This is kind of the national research and literature from the University of Delaware. They have found that those long-term positive impacts can extend into middle childhood and really buffer the impact of toxic stress. And so we were looking to see if we could replicate those same results here in Kansas. So here's the map. You can see a service map of the 5 sites and the areas that they were serving in Kansas. The initiative supported 2 key activities across settings and geographic locations in the state. So first was the integration of a screening tool, the household strengths and strain inventory, to help identify families for referral who might be a good fit for the ABC intervention. And then second was the implementation and evaluation of the effectiveness of attachment biobehavioral catch-up, the intervention. So as we thought about those kind of main targets for the initiative, we as evaluators and project staff really thought about nested areas of impact, potential impact as a result of this initiative. So starting with the child, the target child who was the target for the intervention, expanding out to the caregiver and caregivers who were the main targets for the intervention, but then having the recognition that there would be ripple effects, right? If you're introducing new ways of interacting between the parent and the child, that's going to have ripple effects into the larger household. And so we hypothesized we would see those ripple effects out. And then of course, by expanding capacity within the state related to services and kind of bringing additional recognition to the area of early childhood, we hoped to also see impact related to the service settings and systems. So these were the areas that we were focused on kind of assessing and measuring throughout the intervention, throughout the evaluation. This is just a kind of overview of what the evaluation consisted of. So as I mentioned there, so we did both an implementation evaluation, which means we looked at how the initiative was being implemented, how ABC was being delivered across these different settings and systems and geographic areas. And that implementation evaluation included things like interviews with parent coaches and supervisors and funders, surveys, and discussion within our learning community. And so we pooled all of that information together related to implementation. And then the other piece was the outcome evaluation. And so we started with screening, as I mentioned, screening using the household strength and strain inventory, which measures for risk for toxic stress and then also protective factors against toxic stress. Then at a baseline study enrollment, we collected data measures related to child functioning well-being, parent or caregiver functioning well-being as well. And that included cortisol testing to test of a subsample of our population, not the entire evaluation population, but cortisol testing, which measures kind of the stress, right? It's an indicator of stress and toxic stress in the children. So then the ABC intervention was delivered by the parent coaches. As I mentioned, it is 10 sessions, and so is intended to be about a 10-week intervention. Our average time to completion was a little longer than that, about 5 months. And then post ABC completion, we did the same measures we had done at time 1 to see if there were changes in those areas of impact. And then for that subsample that was doing the cortisol testing, we also did a post 6-month data collection related to the cortisol. Okay, I'm not going to go into detail about the implementation evaluation. I just have a couple things I wanted to highlight related to that, and then I'm going to focus more on the outcome study. But I think it's really important when delivering an intervention in new contexts and with different populations that the evaluation is not just of the outcomes, but also the implementation itself is necessary in order to ensure fit, successful implementation and sustainability, as well as optimal outcomes. And that's why it's always important to me that we include that implementation evaluation. So as part of the implementation evaluation, we collected information from the parent coaches and their supervisors about what the ABC intervention meant to them, or things that describe the ABC intervention. So you can just see this is just a word cloud with things that stood out to the parent coaches and supervisors about the intervention. So you can see impactful, challenging, relationship, reduces stress, nurturing, beneficial, and trust. And you can see some of the quotes there from the parent coaches and supervisors. I also just wanted to highlight a few key challenges and facilitators related to implementing ABC in Kansas. And so related to the intervention, some challenges that were identified is that ABC is a very targeted intervention. really targeted at the relationship between the parent and the child, and also which can make it difficult to figure out how to address those basic needs. And then also sometimes the families, it was difficult to get them to meet on a regular basis. But I think it's important to note in terms of facilitators that helped kind of balance out some of the challenges, is that the parent coaches received extensive support and training and coaching from the ABC developers. And also that was, kind of at this broader, like, national level, but then locally we had these Kansas learning communities where all of the parent coaches and supervisors, we all came together on a regular basis to share those lessons learned and strategies related to the challenges I mentioned on the left. In terms of internal setting within agencies and within the delivery of ABC, these are common challenges that you're going to see with any intervention: staff turnover, and then also staff difficulty balancing ABC with other professional responsibilities. So as folks were learning the ABC intervention, it takes a lot of time commitment and effort to learn this and get trained in it and certified. And so it was difficult at first for folks to figure out how to balance that with other parts of their job. But I think what really helped with that in terms of key facilitators is really the passion and the commitment we saw from the parent coaches about working with this population, and also their belief in ABC, which kind of helps them work through the struggles related to kind of new learning and balancing of different pieces. And then also that support from the agency leadership and supervisors to help them navigate the difficulty in terms of turnover and balancing roles. And then in terms of external setting, the one challenge I wanted to highlight and mention was engaging outside partners as champions and referral sources. At first it was difficult because people didn't know about ABC or understand the benefits. So it was difficult to get them, to get folks in to send referrals. But the support that our sites received from the funders, from the evaluators, and then in terms of the money, which helped, grant money and support, which helped bring in these champions and referral sources. Okay, so who was served through the Kansas ABC Early Childhood Initiative? You can see here a breakdown of our sites and the number of families served. So overall, in terms of screening, there were 536 families that were screened. And you can see here 402 families actually were enrolled and participated in ABC. And that actually kind of, in terms of number of actual kids and caregivers that were impacted as a result, that was 682 caregivers and 907 children. And you can see, as with all interventions, we did have attrition of folks who didn't complete all the way through. Okay, so a little bit more about the children and the caregivers who participated. So you can see here, there were, it was almost even, but a little bit more male children. And one thing that I think is really important to note about our sample is that we did have several parent coaches that were actually delivering ABC in Spanish. And so you can see here, and so that was some of the targeted referrals and that came in. And so you can see that in terms of child ethnicity, 48% of the children were Hispanic or Latinx. In terms of caregivers, you can see it was predominantly mothers at 92%, and language spoken in the home, about 74% English, but about 22% Spanish. And again, so this is, due to the kind of targeted nature of having some parent coaches that were delivering the intervention in Spanish. All right, so a closer look at the outcomes. So as a result of ABC, we were really excited to find in the evaluation that the intervention led to healthier children, more confident parents and caregivers, stronger families, and more comprehensive services and systems. So what does that all mean? You can see on the right-hand side of the slide there a breakdown of kind of those outcomes and the outcome measures we were looking at there. So caregiver concerns regarding child social emotional function decreased after participating in ABC. The children's cortisol levels as an indicator of stress did become more normalized. Parent coaches rated children's overall well-being as more positive. Caregivers' knowledge and beliefs in their caregiving abilities increased. In interactions with their children, the caregiver intrusiveness went down, while sensitivity and delight went up, which is the directions we would want to see with those. And caregiver capabilities significantly improved, and we had expanded capacity for early childhood services across the state. So I'm going to go up into each of these a little bit more, and I have a quote too, because I think that hearing more from the parents and the coaches in their own words about the impact is important. So as I mentioned here, child outcomes, healthier children. So the caregiver concerns regarding child social emotional development decreased from the start of ABC to after ABC completion. And the parent coaches, they rated the overall well-being of the children more positively after completion. So here's a quote from a parent coach kind of exemplifying this. The child's language and words have just exploded, with mom following the lead more. The child has language delays, but each week he has tons of new words. As I mentioned, we did do cortisol testing for a subsample of our population. And what we found is that children's cortisol levels, and again, that's an indicator of stress, did become more normalized, especially for children with the highest cortisol levels. So as a whole, statistically, there was not a statistically significant change from for the whole sample from before ABC to after ABC. But in particular, when we looked at the kids that started at the higher levels, those were the ones where we saw the most significant improvement. But overall, the toxic stress screening indicated the majority of families actually had low to moderate levels of risk and toxic stress and more normative patterns of cortisol prior to the intervention. And therefore, those families had less room for improvement in this measure afterwards, which is why, as a whole, the sample is not statistically significant improvement. So looking at more confident parents and caregivers as an outcome, as I mentioned, after ABC completion, the attachment and communication beliefs improved, while minimization, spoiling beliefs decreased, and this is all positive caregiver outcomes. Additionally, caregivers rated themselves as having stronger beliefs and stronger confidence in their caregiving abilities. And you can see that in this quote here. So I'm a first-time mom, and I really didn't have a clue what I was doing. So it was very helpful to see different ways of interacting with her and then finding out she is her own person. Here's another one related to more confident parents and caregivers. You can see parent capabilities significantly improved, and caregiver intrusiveness went down in terms of interacting with their child, and their sensitivity and delight in interacting with their child went up or increased and improved. So here's a quote from another mom who participated in ABC. I would recommend it because it's a very good program. Like, it helps you understand more and it helps you relieve the stress you have, because you can't go to another parent and be like, oh, well, I have this problem and this problem with my child, and they're going to judge you. And ABC will not judge you. They will help you. Instead of judging you, they're going to help you fix that problem or show you how to fix that problem. So all of this I mentioned earlier about the ripple effects of because we are impacting that child and that caregiver, that other caregivers or other children in the home are also going to be impacted, which is going to have the overall impact on the whole family and make that whole family stronger together. So parent coaches rated both family environment, interactions, safety, social life, self-sufficiency, and health of these families all as more positive after completion of ABC. She's able to soothe herself better. So that way she enjoys more of her dad. Him coming home and then telling him that she won what she wants and then throws a tantrum and then that's it. And now she gets home and she can kind of tell him what she wants, and we can both understand, and then they have more time together. I did want to focus in quickly on implementation and outcomes with families who received ABC in Spanish, because I think this is important given the size of our sample here. And as I mentioned, 41% of the families served were Latinx, and 22% primarily spoke Spanish in the home. And I want to highlight the fact that the child and caregiver outcomes were similar for families who received ABC in Spanish to those who received it in English. So all of those significant findings I just presented were the same for both groups and had the same positive outcome. And I also think I want to highlight that we did interviews with parent coaches about the delivery of ABC in Spanish, and found that there were positive experiences and felt like it was a good fit for those families. But it also revealed that there is an opportunity to do more in terms of thinking about how we translate interventions and adapt them for families with different ethnic and cultural backgrounds. So here's one final quote I like from this one parent. I think the one thing that I remember the most is just the constant reminder that I am a good mom, and it's okay to sometimes get a little frustrated, as long as you're understanding how the child feels and not just kind of pushing their feelings aside. That's one thing that I remember the most, is always making sure you're communicating well with your child and knowing that you're understanding well with them and figuring out their need, and not just kind of guessing at it. And not fully putting into consideration that just because they're a baby or they're so young that you wouldn't have feelings when they do. One final slide here related to that piece about the more comprehensive systems and services. We did say, this resulted in that. And you can see that from the fact that we had 3 ABC trainings that were held in Kansas with 39 infant parent coaches and 10 toddler coaches trained. Related to the systems, the ABC sites have been successful in finding new ways to continue to deliver ABC after the initiative ended. And also, ABC has been part of 7 different legislative hearings, 2 legislative bills, and more than 14 presentations. And there was a group of Kansas stakeholders who went to New York City to visit a model program there. And so you can see that this initiative has led to more comprehensive systems and services in Kansas. So I think just in closing, I think it's important to note overall this initiative successfully increased early childhood capacity and awareness in Kansas. It made a difference in the lives of 682 caregivers and 907 children. It provided valuable learnings about how challenges in implementation can be creatively overcome, and further demonstrated early childhood interventions like ABC not only make good economic sense, but most importantly, empower individual families to raise happy and healthy kids and provide those strong foundations, helping them to reach their full potential. Thank you so much. And I'm happy, David, if you want to have a few questions or.
Thank you, Amy. Does anyone have any questions for Amy, either in the chat or want to raise their hand or? Amy, there's a question from Katie Hart. How is cortisol collection impacted by the pandemic? Which I think is a great question.
That is a fantastic question. It was impacted in lots of ways. I will say, that was towards the tail end. The pandemic was starting towards the tail end of us collecting cortisol, and so we were lucky in that it was towards the tail end, but a lot of those samples ended up being compromised, and we couldn't use them for fear of them being compromised because of COVID or not being able to collect them soon enough and that sort of thing. And so our sample did end up being smaller, particularly at that time 3 time point, because we were not able to use a lot of that data that was collected, or we couldn't collect during once the COVID pandemic started.
Great, thank you, Amy. Any other questions folks have? And if you don't have questions now, Amy will be here for the remainder of the presentation. We can ask questions to Amy and any of the other presenters. So One last call for one or two questions for Amy. Well, with that, I will thank you, Amy. I'll turn things over to Katie Schoenhoff, the Director of Programs at the United Methodist Health Ministry.
Well, again, thank you, Amy, for the great presentation and the questions already asked. I will say, we know, based on what we're learning even through this process, that evidence shows that caring and responsive relationships with adults early in life can prevent those developmental delays and chronic health concerns caused by the continuously elevated cortisol levels. So we've been very pleased with the results that we've experienced through the ABC initiative and seeing those more normative cortisol patterns over the course of the project. The research and project affirm for the foundations and for us at the Health Fund, the project, the impact of ABC on families in Kansas, and shows that appropriate coaching, encouragement, and resources for families experiencing stress make a real difference in how children grow and thrive. We also appreciated that this multi-site project demonstrates the life-altering benefits of investing in child health and family well-being from the start, that they can make an important impact in the health and well-being of both the child and the caregiver. And I think the other piece is that beyond the research highlighting the benefit for the parent-child relationship, we were very pleased with the results for the use in various settings and locations across the state. This intervention has worked very well in various settings. Again, we had mental health centers, we had different agencies that were supporting different types of work, and each brings both unique opportunities and for referrals for the families and children served. Also, I would say the other pieces that we really appreciated about this initiative is the sites worked very, very hard and did a great job partnering with their communities to increase the referrals and supports for families. We know that because of ABC being a very brief intervention and has very targeted focused goals, it is imperative to the work and also to recognize that it serves this for a very short amount of time, and it is a great supplemental intervention. But those other wraparound services are crucial to the family's success and continued success moving forward, and other home visiting services along the way. Along with the referral and community integration, a number of the projects were also able to find funding and ways to build that support longer-term sustainability. As foundations, this is so important for us to be able to lift up important ideas in hopes that others will come alongside us and fund these initiatives long-term. Our parent coaches and supervisors worked tirelessly to support all families in their communities. The increased use with Spanish-speaking families over the course of the project has been very important undertaking for serving everyone in Kansas. And as funders, we are pleased to see all the implications and support that provide equitable opportunities to families to serve everyone. And again, we were just really happy with the results from that as well. And then, I would say as the Health Fund and then also as part of the foundations, the focus of our work is really striving to answer some of these tough questions, like how do we help children at risk build foundations of healthy development, preparing them for success in school and landing them on a path towards strong relationships and economic success. Within our work in the early childhood space, this is something that we try to think about pretty regularly. And we now have clear and consistent research regarding how to do just that. We are very pleased with the results of this effort and demonstrating that this intervention can have positive impacts on parents, children, and the early childhood system. Results also indicated children involved with the ABC curriculum have continued pro-social behavior patterns, including, again, the more normative cortisol patterns, as well as like increased executive functioning, which help them be able to sit in a classroom and participate longer term and help them enter kindergarten ready to learn. So we are very pleased with that part of it as well. we will say that this project just reinforces that we think that Kansas needs to continue to invest in our children and as early as possible to have the positive long-term impacts on our kids. Finally, I just have to say thank you so much for those who have been contributing partners to this. You know, the project sites, the supervisors, the parent coaches, the evaluation team, for your tireless effort on this initiative. All of you had such a strong commitment to the work, and we are so thankful for your willingness to participate and be a part of this effort, to be able to demonstrate what we were hoping to all along. So with that, I'm going to turn it over to Blanca Ansborough from the Project Eagle to talk a little bit about her experience as a parent coach. And then after Blanca is finished, I will let Dana go ahead and talk as well. These are two of our parent coaches who actually were some of our first ones. They've been with the project from the beginning, and so being able to talk about their experiences, we just wanted to give them the chance to do that. So thank you all for giving me a few minutes of your time. And with that, I'm going to turn it over to Blanca.
Oops, sorry. Thank you, Katie. I appreciate it. Hello, everybody. And I just wanted to say thank you very much for allowing me to speak today about ABC. I've been with the ABC program, as Katie was saying, since the beginning, and I am one of the bilingual ABC parent coaches. So mostly I worked with families that were Hispanic. And as Amy was saying, in part of it, it was a challenge because trying to get the translation for the parents to understand was a little difficult, but the ABC supervisors in Delaware really did help. And Amy and Katie also assisted a lot on those. So it was very good for our families. And these families learned a great deal. Coming into the home, you know, helping them see that, as it was said before, not saying that you are a bad parent or don't know what to do, just giving you more tools to help you with what you're doing in a simpler way. Understanding your child, helping your child not throw tantrums, helping your child, you know, understand you as well. And something that I was very happy to learn was that the ABC model isn't just for infants and toddlers. It goes along all the way through teenage. I had a mom that I was working with her 3-year-old. This is a little story. I was working with her 2-year-old, and she came to see me, and she was like, you know, I used the strategy you tell me on my 2-year-old on my 10-year-old, and it worked. So I was like, well, that's great. You know, she says, I sat down and listened. He was impressed on everything that was going on. So it's just tuning in a little bit to help you with your older children. So that's one of the greatest things about ABC, that it's not just meant for the infants or the toddlers. You can always build on it as you're growing. The tools that are used for ABC, the nurturing and following the lead, and also learning their cues, being able to understand them, those are all things that parents have but don't know how to use them. So ABC brings it out, and the comments that we give them helps them as well. With the Hispanic families, it was great, because they were like, well, he throws a tantrum every time I don't listen. Well, it could be a reason why, you know. So, you know, helping them to see that. And as Katie was saying, bringing that to the families, it brings a joy, a fulfillment that they are there and they're learning their children. And their children are attaching to them. Not just, you know, in a way, they're really learning who their parents are, and they're getting that confidence of their parents and things like that. So it's great. I had a family, and this will be the last story. I had a family that I worked with, and as Amy was saying, it's a 10-week program, but it doesn't end in 10 weeks. So this family, I had her from the beginning, and her baby was born. When I ended, her baby was 1-year-old. So that tells you how long it took for me to do it. The challenge was her mom had cancer. her sister was sick, her kids were sick, but through all that, the mom never gave up. And every time I would go back, we would review it, and I was stunned because she would remember and she would recall everything that we did. And she was like, it is working. When we ended the program, her child's temperament was better. He would go to her and she would pay attention. He would talk to her, and instead of throwing a toy at her, he would bring the toy, or he would ask her. Instead of going towards his sister violently, he would play with her, and he would go get his dad and bring him in to play. So all those things were not there when we started ABC, and they built on it. And the parents are still working on it. They have a third child, and they've built that with that third child. So thank you very much for listening. Sorry I took so long.
Hi, everyone. I'm Dana Schatz, and I'm also an ABC coach. I do both infant and toddler programs, and I'll agree with Blanca. It's great for everyone. I use it on my dog when my dog gets dysregulated, and it does make a difference. On everybody, every age. I know I have 4 boys, and not one of them came with a user's manual. So you're kind of stuck on your own. And one of them I even brought home from the NICU. And I'm like, I'm a teacher. I'm not a nurse or a doctor. I don't know what to do. And luckily I had, some family support, some people that I could call. Am I doing this right? Is this okay? But as a parent, a lot of times we feel like we are just out there on our own, and we're just guessing and taking stabs in the dark. And this program is amazing. I think we could definitely change the world. We can change our state if we offer it. I always joke that, if the funding ran out, I would do bake sales because I just believe in it so much. But it's amazing to see just the difference that you can make with the families. So especially the infant program is amazing, but I think some of the bigger changes I see is in the toddler program, because a lot of times, especially with toddlers, I remember like I'm in a deer in a headlight. I don't know what to do, and my kid is melting down. And, if you're at Walmart, you're about to panic. But we tell the parents, you know what, these behaviors are not malicious. They're not trying to trigger you. There's a reason behind it, and that reason is dysregulation. So I'm a visual learner, so I always tell parents, okay, I want you to envision right now, if we could see inside your child's brain, what does it look like? What kind of chemicals are being released? And we know when kids are dysregulated and upset, we have lots of cortisol. And we talk in depth about, okay, what's this cortisol doing? It's slowing down their brain growth. It's affecting their health, maybe in the future, all these things. So what would it look like if things were happy and everything was going well? What does your child's brain look like now? So during the intervention or during the sessions, I would say, stop. Tell me what your child's brain looks like right now. And they'd say, oh my gosh, my child's brain is flowing full of oxytocin and serotonin, and they're able to learn because they're doing all these great things. And then during a meltdown, I'd say, stop, wait, what's your child's brain look like now? Oh my gosh, there's lots of cortisol. So, okay, what can we do? What can you do to get your child back to a regulated state? And for some reason, that visual just really sticks with a lot of families to help them understand this isn't malicious behavior. This is a release of cortisol and other things because they're dysregulated. And we know when kids are adults, whoever, dogs are dysregulated, we cannot learn. And so we've got to get them to that regulated state. So I love that visual. I love the program. I'll tell a quick story about a family that I've known this mom since she was in junior high, and then she grew up and had a family of her own. But I noticed with her first daughter, we were at a Halloween parade, and her daughter was probably 2.5 when she fell. And the first thing she said was, see, I told you, you're going to fall, you're going to get hurt. And I was like, oh, my ABC heart just wants to say, wait. Let's stop for a second. Let's acknowledge that she's hurt, number one, so that she knows she can depend on you. Even if you have told her, stop messing around, you're going to fall. Start with that connection, that relationship first. Oh, I know you fell down and I'm so sorry. Mom's here for you. I'm going to help you. And then move on to that. So after her second daughter was born, I was able to actually do the program with them. And when that mom and dad both realized, oh my gosh, my child, number one, can have feelings towards me. I still get mad at my parents. I still get mad at my brothers. I still get mad at whoever. My child can also have those feelings too. They can get mad at me. They can be happy with me. Their whole world just changed. And you could see the light just come on in both of those parents. And she said at the end, I'll never forget it, broke my heart. She said, you changed my life. You changed my life as a parent, and you changed my life as a family. And so again, I would do bake sales to make this program happen. I really think we can change the world if we offer this to more people. So thank you.
Great. Well, thank you so much, Dana and Blanca, for that important perspective, and Katie as well. Now I'm going to shift gears a little bit and turn to Senator Pat Petty, who is the ranking member on the Senate Public Health and Welfare Committee, and just a really great early childhood leader, for her reaction as a policymaker. Senator Petty.
Well, first of all, I appreciate the presentation today. It's just so interesting to hear, not only from the findings, but also from the ABC experiences, and then from the home visitors and their reaction within their families. From a policy standpoint, I would say this kinds of information is just invaluable. But one of the things we need, we need to continue to look at, is some of these families long term, so that we can see if we're having if we can use this for evidence that ABC is such a valuable tool and investment for, as was said early, more families, so we can show that these impacts on families and on family relationships, a parent with their child, is carried through into school and into later life. And so I think that's what is so important, that we continue with follow through on at least a small percentage of these families that have gone through this program. I'm very much excited about looking for ways to help support this investment, so that we can continue it long term, and that we can have the investment of the state supporting the home visiting programs. And that this tool, as was mentioned by the home visitors, even though it's a 10-week program that's used, or maybe longer, depending on the circumstances of the family, that's used at one stage of a child's life, that it has long-lasting impact, and has a long-lasting impact for the relationship of that parent with the rest of their children, even though they might only go through this with one child. So I just have to say, I'm very excited. I think I did have that opportunity to go visit the program in New York City, and was excited for us to have this opportunity in Kansas. As always, when it comes from a state perspective, it's how can we look for those dollars to help to continue to support it. And I guess that did raise some questions for me about it looked like from the intervention that it was more confidence of the parents and caregivers was one of the biggest returns on investment, as well as stronger families, particularly with safety, which I think is always so important. And I think the cortisol level issue is important, but the question would be, what would be the sample size to get that information back? And then the other question would be, so I think we need to think about how can we talk from an investment about how does this impact these parents then in their employment? Are they able to now use these tools with their children to be able to have a stronger family system, that they aren't facing those traumas that might cause them to not be able to go to work, and and I would ask, and maybe this hasn't happened with our sample, but have our parents who've gone through the program at this point in time and it's great that it's in different parts of the state. Have they continued to be supporters, and are we looking at how we can use them as the messenger? And then it was mentioned earlier that some families don't always recognize what this is going to provide. And so I guess, and maybe this was done too, bundling this with other services so that the parent not only is going to go through the ABCs, but maybe then also get directed how they can have training for a job so that they are employable as well.
Great. Well, thank you for that perspective, Senator Petty. I think one thing I really appreciate is just the emphasis that you put on research, on understanding seeing the research, there's benefits, but we also need to be judicious about asking these questions. I know Amy will probably answer some of the questions based off of her research and some other evidence that she knows about, but I'll turn things over to Rachel for her reaction, and then I think we can address some of those questions if that works. Rachel?
Hi, David.
Hello, thanks for joining us.
Yeah, it's so good to see some familiar faces from all over Kansas. My name is Rachel Marsh with the Children's Alliance. If you're not familiar, we focus on the child welfare and family well-being system. And listening to this research and reading this report was just really exciting because although you're using different language, you're really saying things that we're excited about in child welfare. When you talk about what you're benefiting parents with, you're improving their knowledge, their attitudes, and their behaviors. And those are three protective factors that we know about that help reduce the risk of child abuse and neglect for youth and for children. And so in addition to parents feeling more confident, feeling more happy about being a parent, and having better kind of attitudes and understanding their children, you're also improving the child's well-being, the child's cortisol, the child's behaviors in such a way that in the future, it also reduces the child's vulnerabilities to risk factors that they may face. So it's really the every corner that you're addressing through this program for young children. So I, of course, had to go look and see whether this program is on the Family First Clearinghouse. And I think with this new research, there is definite reason to revisit whether it should be a Family First approved funding at the federal level. And I also think that the federal government is really looking upstream, continuing to look upstream, whether we're doing prevention even before risk of child abuse and neglect. So I did immediately go to those policy angles with the federal government, but I was also really excited to see how many places that ABC has been plugged in within Kansas through Family First programs, the Department of Education, through Medicaid. And I really think that probably looking at building on those successes to make sure that we're expanding and sustaining the training and investment that has been made so far in the coaches and the programming. That's something that we, from a policy perspective, we usually do see. We see an investment in a particular training and then a fall off of that investment over time. And we don't want to see that happen with such a really robust program that it improves families. It does do that two-generational whole family approach, which is really great. And I can't thank the health foundations here, David Jordan, enough for really bringing together that triangle of public health, child welfare and safety, and early childhood, and recognizing that these are all the same youth that we're trying to serve, that we're trying to improve their outcomes in over the long run. And also focusing on something that builds on a parent's strengths and confidence. I think it was mentioned 2 or 3 different times that when a parent feels confident, they do better. And so that is something that we want to continue. And so I'm excited to see where this goes and help however I can in making sure that the program maintains sustainability and impacts more children and families.
Excellent. Thank you so much, Rachel. Amy, I don't know if you have any reactions or thoughts as you heard from Rachel, Senator Petty, Blanca, Dana, or Katie that you wanted to react to. And I see a question also from Katie. So I just go to you before I keep talking.
Sure. Yeah, I think that one of the things I was thinking about as I was listening is, I think that it's important again to emphasize that there is a lot of literature about the longer term impact into middle childhood. And so we do know that, not that we didn't do in Kansas, but the national literature, that there is that evidence already, that we do know it has long-term impact and effect. And I would love to be able to follow the kids, for a longer period of time, but I also do think it's important to emphasize that we do have evidence already that we know that this can have those longer term impacts. And I think the other thing I wanted to mention is we didn't talk at all about phase 2 today, but there is a phase 2 that is occurring with additional emphasis on the toddler version. And so that's getting us closer to that school readiness piece. And so as part of our evaluation for that, we are looking at more specific measures that look at like executive functioning and things like that are going to prepare a child more for school in terms of entry into school. And so we are measuring those things in this second phase 2 of the initiative and the evaluation, and as well as we've added measures related to caregiver stress and caregiver empowerment. So that flip side as well. Those are two pieces that we heard a lot of stories about from the parents and the caregivers and the parent coaches, but we didn't actually measure in phase 1. And so we've added those pieces in. So we'll have some actual quantitative data related to that as well from phase 2. Quickly related to the cortisol, I think it's important to note that our sample size was actually what we thought we needed. I mean, statistically, it was the sample size we thought we needed. It just ended up that the families, some of those families were not as severe in terms of the toxic stress levels, which meant they didn't have as much room for improvement. And so they improved. I think that's really important to note, is that they all had that more normalized patterns of cortisol. It's just that there wasn't as much room for improvement because some of the sample did not have the symptoms that were quite as severe, or the experiences that were quite as severe. So we would need about the same size in terms of sample, but just folks that had kind of that more severe level of toxic stress.
Great, thank you, Amy. There's a question for Senator Petty in the chat that I'll flag in, but quickly before I pivot to that, in terms of Katie's question about sort of sustained funding for ABC, I think like most home visiting programs, there is really a braided approach to continuing funding for ABC. So there continues to be some investment from the foundations in maintaining and sustaining some of the ABC programs, I think. And then the other exciting piece is some of the sites have identified some reimbursement for providers, specifically some that are social workers and functioning in the CMHC, the Community Mental Health Center setting. Other providers have access for Family First grant dollars to support this through the State General Fund discretionary portion of the Family First program. So as Rachel noted, we think this evidence will help us continue to make the case that this belongs on the Family First clearinghouse of approved programs. Part of it is just it's live research, and sort of that's been just the type of research, because it's very highly approved research, not the KU program, the existing body that exists on SAMHSA and California Clearinghouse. And then I think the other piece is that we continue to support training, and groups like Johnson County Mental Health, the Tiny K program throughout Kansas, and other entities see the value of this program and aren't necessarily looking for funding to implement it, but looking for support for the training and supervision during the certification process. And Kansas Health Foundation and the Health Fund continue to support training and sustainability strategies. So we see ABC as continuing, and we see growing interest, but sustainability from a policy standpoint, both from child welfare, family preservation, Family First, from funding on the education front, as a proven strategy to improve school readiness and student success because of the impact of executive function. That's an area of focus from a policymaking standpoint. And then also from the Medicaid standpoint, I think all evidence-based home visiting programs, I think that could be a focus of advocates as we approach CanCare reprocurement and the new Medicaid contracts, is how does the state use Medicaid to support home visiting and programs like this that have such an impact. So with that, I would go to Senator Petty with the question from Mitch Rooker, which is there a way that fellow legislators could learn more about ABC? And is there advice that you have for constituents in lifting this program up?
Oh, thank you so much for those questions. And I certainly do agree with everything that Rachel Marsh said about the program and advocacy for it moving forward as well. I think anything that we can do to invest in our parents and their relationship with their children is a positive for all of our Kansas families. So when I guess I kind of got off of the issue here. Say that question again.
Of course, I'm going to mute myself at one point. And for folks that have to drop off, this whole session will be recorded, and we appreciate the extra time. Is there a way that your fellow legislators could learn more about early childhood issues like ABC and others? And as advocates and constituents, could you encourage our elected officials to join a caucus of some kind?
Absolutely. So I do chair the Early Learning Caucus, and I definitely will work with you to have a presentation for our Early Learning Caucus during this upcoming session. But I do think that having a presentation before Ways and Means and the Appropriations Committee, for example, two of the largest areas, you have the chair of Appropriations lives in that area, and the chair of Ways and Means. So they would have had some of their constituents directly impacted, just like I would have had. So I think those are two places as well. And it was mentioned about, I think you brought up about DCF and the Department of Education, and anything that and this would be certainly would be a way, once those presentations are made, if there's anything that we can then do legislatively to help with that, getting the ABC added to that clearinghouse list for Family First approval. I think it looks as a real, when it comes to the legislature, it definitely has got to be positive that now Family First dollars, as well as Department of Education dollars and Medicaid reimbursement, are being used to help with this program in some parts of our state. So I think that certainly shows that this not only private investment that has been there and continues, but also looking at how that private investment can work with those public dollars is a real positive.
Excellent. Thank you, Senator Petty. And we'd welcome the opportunity to come to the Early Childhood Caucus and also support any broader early childhood efforts. This is all a bigger effort of just showing how important it is to invest early. And we appreciate your leadership on all of these issues and your leadership of the caucus. Any other questions or any parting remarks folks had? Well, with that, thank you, Senator Petty. Thank you, Amy. Thank you, Blanca. Thank you, Dana. Thank you, Katie. And thanks to all of our funding partners and to everyone for joining us. And thank you to Rachel, who did a great job as well. So it was just great to hear from all the presenters and also see the research and to see everyone sign in who made this project a success. So we look forward to future engagement and connecting soon. So everyone have a great day, and thanks so much.